Now, in the fourth section of our lecture, Acoustic Neuroma, we will discuss about the radiological tests and diagnosis. In this section, we will mainly talk about the radiological tests for the diagnosis of acoustic neuroma. And then we will talk about the evoked response audiometry and what are the different differential diagnoses of acoustic neuroma. So radiological tests are plain X-ray is done, which can be done in three views. We have trans-orbital view, stenverse down, and submento-vertical views. So plain X-ray can be done for the diagnosis of or the examination of tumor acoustic neuroma, which is done in three different views: trans-orbital, stenverse down, and submento-vertical views. Usually, plain X-ray give positive findings in 80% of patients, and usually the growth can be detected or found. Small intracanalicular tumors are not detected by the plain X-rays, and they need special radiological techniques to find out the tumor. So mainly plain X-rays are effective if the tumor is large enough to be visualized. CT scan. CT scan is a tumor that projects even 0.5 centimeter into posterior fossa can be detected with the help of CT scan or the computed tomography. So even 0.5 centimeter tumor, which is very small tumor, but it is projected into posterior fossa of the skull, it can be detected by CT scan. If combined with intrathecal air, even intrameatal tumor can be detected. So CT scan is very helpful in the diagnosis of acoustic neuroma. CT scan replaced earlier methods of pneumoencephalography and myodilmeatography. So as we have more advanced technologies, now CT scan and MRIs replace the old method of diagnosis of acoustic neuroma, in which we had pneumoencephalography. Pneumo is for ears and encephalography is recording of the brain, and then myodilmeatography also. Then MRI. MRI is the other radioactive test or radiological test done for the diagnosis of acoustic neuroma with gadolinium contrast. This is the Omni scan, which is the gadolinium contrast used for the diagnosis. It is superior to CT scan for the diagnosis of acoustic neuroma, and it's the gold standard for diagnosing acoustic neuroma. Very helpful in the diagnosis of acoustic neuroma is the MRI with gadolinium contrast. Vertebral angiography, it's helpful to differentiate acoustic neuroma from other tumors of cerebellopontine angle when there is doubt present. So other 80% of acoustic neuromas are in the cerebellopontine angle. So this technique, vertebral angiography, is helpful to differentiate other cerebellopontine angle tumors. This is the vertebral angiography, vertebral artery that can be visualized by after the dye is injected. Evoked response audiometry is very useful in diagnosis of retrocochlear lesion, not very effective for cochlear, but retrocochlear, it's very, very helpful. In presence of eighth nerve tumor, a delay of more than 0.1, 0.2 milliseconds in wave V between two ears is significant. So it's important for this evoked response audiometry is very helpful for retrocochlear lesions, and in the presence of eighth nerve tumor, which is the acoustic neuroma, it involves vestibulocochlear nerve. Usually there is a delay of more than 0.2 milliseconds in wave 5 or V between two ears. Differential diagnosis of acoustic neuromas, it should be differentiated from cochlear pathology, Meniere's disease. Meniere's disease, when we talked about Meniere's disease in one of our lecture, I said that Meniere's disease have same symptoms like there is vertigo is very common, there is dizziness, and there is loss of balance. Associated with that is motion sickness, nausea, vomiting. So it is very, very closely symptoms with the associated with each other. Then we have cerebellopontine angles tumors other than the acoustic neuroma should be differentiated. Other tumors of cerebellopontine angles are one is acoustic neuroma, then meningioma, epidermoid cholesteatoma, arachnoid cyst, schwannoma of other cranial nerves, aneurysms, glomus tumor, and metastasis. So all these are different tumors that can be present in the cerebellopontine angle and should be differentiated from acoustic neuroma. So that was all about section 4. Thank you for watching sqadia.com.